everybody, my name is Suha Tayyeb. I'm an intern at Mededia, and today we'll be talking about how to write a case report for a medical journal. This presentation has been compiled along with Dr. Khwaja and Dr. Tariq. Alright, let's go. So before we begin what a case report is, we need to know a little bit about medical journals. Why so? We need to make sure the medical journals that we're looking into are reliable, are in good standing. So this journal that we're interested in is a double-blinded one, is it a peer-reviewed, is it indexed, what is its impact factor, citation index. We'll talk about all these terms right now. So what is a double-blinded journal? We have the reviewer and the author identities concealed from each other. Now this helps in minimizing bias. Then what is a peer-reviewed journal? A peer is someone who is within a similar field, could be at a different post, could be a higher post, could be a student, could be a senior, but within the same field. So articles that are written by, for instance, medical professionals are reviewed by peers, in this case are going to be other medical professionals, before the article is approved and sent for further evaluation. Then we talk about PubMed.gov. Now, it is a free search engine of database of references and abstracts on life sciences and biomedical topics. Simply put, think of PubMed as Google search, but for research articles. Then, what is an indexed journal? So it's a journal that has been listed in a database. For instance, PubMed is a database. We could use the analogy of PubMed being a book, and the index page has the journal names listed on it. If it's not there, it means it's not indexed. Impact factor, now, arguably is the most important factor. You can consider it as impact factor being rating of a journal based on the article. So impact factor is to do with number of times an article in that specific journal being cited over a span of 2 years. Next term is in citation index. Now this measures the number of time with which a specific article has been cited or quoted in other researches. So this is solely to do with just the article and how many times other people have used it in their research. Now we get on to talking about what is a case report. So a case report is a description of a clinical case which is unique, including imaging to reveal a disease, a new therapy, or a previously unreported complication of a disease. So case report is valid as long as you're adding something new to the medical literature. Now there's another term that's called case series. So not to confuse a case report, as the diagram shows, is to do with an unusual finding in a single person. But case series is to do with unusual findings in multiple, like a small group of people, like for instance 2 to 10 people showing similar indications of a disease which has not been reported previously. Now let's get into the technicalities of writing. Now before you write, step 1, choose your specialty. You want to be able to categorize the case report that you're writing. For instance, if you are planning to write a case report in radiology or cardiology or neurology, that is there. But you should have an idea of what interests you. And this is helpful because then you will be able to have your researches, volunteer work, electives centered around that specialty, and that would help build up your CVs. Step number 2. Find a medical journal. Now, finding a medical journal is not only limited to finding a good medical journal with all the characteristics of double-blinded, peer-reviewed, indexed, but also a journal that accepts case reports. Now, this is to be taken note of, that not every journal accepts case reports. Okay, here's a little list of case report journals. Most of the journals do accept case reports but are not indexed. So that is also another factor to consider. Okay, number 3, instructions for authors. Why would you want to find instructions for author before you've even written down your case report? There are 2 ways to go about it. One could be that you write your case report and then you format your article your report according to a journal's instruction. Or a more efficient preferred way would be that you wouldn't have to go back and forth with reformatting or editing my case report because I've already been following the instructions. So you can search up for instructions for authors of the journal chosen by directly on Google or on the journal's website. You will look at the format, style, requirements. Format could include font, style, size, color, spacing, word limit. And mind you that every journal has a specific requirement. So here are some examples. So example 1 on the left, we have a case report instructions for case report in Journal of American College of Physicians. Very easy instruction they've given, specifically word limit of 700 and 5 references, maximum of 2 tables, easy. In the example 2, again, really simple instructions, maximum of 500 words, limit of 2 illustrations, so that can be easily followed. But if you're going to target bigger journals, for instance, the JACC, this has a more extensive format requirement. For the word count, you're getting up to 1500, but when you're going to look at other instructions, so now they want title to be 15 words or less, hyphenated word count as single word, page 1 should be title page, page 2 should have keywords, abstract, and there's an extensive list of requirements. Number 4, once you've read the instructions, you need to refer to a few articles of your journal that you've chosen, so you can have a clearer picture of how people have been writing and following those instructions. And then step number 5, the main thing, writing a case report. Now, writing a case report is really simple. It's just like how you write down your cases in your words. You'll start off with collecting information of a case that you find unique. And then write an outline including your case presentation, signs, symptoms, diagnosis, management, follow-up. Once you're done with that, now you can start filling up the introduction bit, the conclusion bit, and the discussion bit. Okay, so what would you write in a case report introduction? So think of introduction being like a funnel, which is broader at the top, narrows down at the bottom. So broader at the top in the sense that in your introduction, you will be introducing the topic very generally, and then you'll narrow it down to why your case is a unique one or how is it unique. Conclusion would usually include our learning pointers, the new parts that are going to be added into the medical literature, and discussion. Then we have formatting of the case report according to the requirement of the journal, and then finally focusing on the quality of graphs, tables, images. Now, nowadays case reports are structured such that a person at first glance could figure out what's going on, what's unique about this case. Journals prefer good quality images explaining everything and good labelings on them, and just like a small paragraph of the case report. Here is a care checklist, and this checklist is preferred, it's encouraged to use by people who are writing case reports, so that way you are not really missing out on essential information. Right, so now we're going to look at an example over here of a case report, a unilateral thalamic infarct. So unilateral thalamic infarct is the rare presentation. Usually it's bilateral. Now, instruction of the journal says that the title needs to include the manuscript title, and they have done that. Full author names, those are present as well, and then full institutional mailing address, that too have been given. Now, in the introduction section, they just wanted to have no subheadings and be precise. So that instruction has been very well followed by this article. Consider it like a funnel. So they've given general overview in the starting few lines, and then in the last 3 lines, they point out what is unique about this case, and that is an acute unilateral thalamic infarct. Then we talk about the main body of the case report, which is our case presentation. So the instruction is really simple. They want a good description of patient's symptoms, diagnosis, treatment, outcome. And this article has stated that really well. They have they've told about this 15-month-old male presenting into emergency department with a right-sided arm and leg weakness. X-rays were completely fine, and the labs showed some anemia over there. And then the CT was the one where they saw hypodensity in the thalamic region. Then they're talking about the treatment over here, management. They gave anticoagulants and IV hydration immediately. In conclusion, they have pointed out new pointers over here, and the new findings are going to be adding to the medical literature. They believe there could be a possible collateral circulation in the right thalamus, and maybe not there in the left thalamus, because of which left thalamic infarcts have been more common. So now we'll be talking about some causes of rejection, and we want to make sure we are far, far away from them. So all the work that we put in this case report writing is fruitful. Okay, number one cause is it worthy to be published or not? So if your case report is not going to be unique, or there's already a lot of literature present, or there are going to be no new learning pointers out of your case report, then there's a high chance of it getting rejected. So to solve that, make sure you perform a literature search to establish if your case is unique or not, to find out how many prior cases have been reported, to compare if the prior cases and your case is any different in any aspect. Number two, if the case report is not relevant to the journal. So it sort of is common sense that if you're writing a case report in the cardiology specialty, you want to make sure that you are going to be publishing in a cardiology journal and not submitting it for a radiology journal. So always pick your journal wisely. Another good tip is that if your research is in a highly specialized specialty, make sure that you pick a highly specialized journal as well. For instance, neuro-oncology, go for neuro-oncology journals rather than neurology or oncology journals. That increases the chances of publishing. More causes rejection include number three, improper formatting. We've talked about this over and over, and how important it is to follow the guidelines of the journal, else there is going to be rejection. And number four, using inconsistent language, wrong language, wrong impressions, expressions, punctuation, grammar, all of that, and not being consistent in the language that you're using. So, for instance, if you're writing your paper in American English, make sure your whole paper is in American English and not in different variants of English. And the solution to that is, there's this book called Elements of Style, and it is a widely used American high school grammar book that you can quickly skim through and avoid such grammatical errors. If you want to become an expert at writing a case report, here's a little bonus tip. You can become student reviewer of index journals, and that way you will not only improve your skill of writing articles, reviewing articles, it will also add plus pointer in your CV. In this analogy, that you are an umpire in a cricket match. So you already know the rules and regulations. Later on, when you're going to come as a player to play on the field, you are already expert at it because you already know about it, yeah? Here is a final summary of everything that we talked. So number one, choose a case report and its specialty and perform a quick literature search to see if it's unique or not. Then you can choose your journal of interest depending upon the topic of your case report. Now you'll search for instructions for authors, look at the format style, requirements, anything additional you would need, refer to previously published 10 to 15 articles so that instructions for the journal sticks in your head. And now you can sit down and write your case report. Format it according to the journal's requirement and you're good to go. I think we can get started at writing a case report now. Thank you so much for watching. Feel free to comment below any questions.